Iowa continues to have the second highest rate of new cancers in the United States. The Cancer in Iowa 2025 report estimates that 21,200 Iowans will be diagnosed with the disease this year, a 0.7% increase from 2024's estimate. The report not only looks at statewide numbers, but also breaks it down by county. KTIV's Katie Koppel has a look at how Woodbury County compares to the rest.
Look at Woodbury County specifically, we see that it ranks 18th in the rate of new cancers, and you rank 16th in the rate of cancer deaths in the state.
Dr. Mary Charlton is a professor in the Department of Epidemiology at the University of Iowa College of Public Health and the director of the Iowa Cancer Registry. She walked me through the data collected for cancer rates in Woodbury County.
Prostate cancer is the most common cancer diagnosed in Woodbury County. And you rank 32 out of 99 counties for the rate of prostate cancer. And that is significantly higher than the rest of the U.S.
Compared to the state as a whole, Woodbury County residents diagnosed with prostate cancer are more often diagnosed at stage 2. But as Dr. Charlton says, part of that is because more people are getting screened.
What we consistently have seen since I've been on the scene is that prostate cancer is very high in western and northwest Iowa. And that's kind of a tricky one to interpret because prostate cancer is one of those cancers, like the more you look for it, the more you find it.
Another cancer type with high numbers in Woodbury County is lung cancer.
Ranked 24th out of 99 counties and significantly higher than the rest of the U.S. You have a higher smoking rate. The U.S. average is 13%. Iowa is 15%. Woodbury County is at 17%. So that's pretty high.
While the rate is high in Woodbury County, data does show a slight drop from previous years. The cancer report also breaks down cancer rates by age, gender, and race. Now, while this is a brief outlook on the data released in the report, Dr. Charlton says the report helps officials see where changes could be made.
We look at the 5 most common types of cancer, and then we compare them to the rest of the state of Iowa and to the U.S., and we try to see where people are off. And are there, known prevention type of measures that can be taken or screening types of measures that can at least improve outcomes among people diagnosed with these types of cancers.
In Sioux City, Katie Koppel, KTIV News 4.
To see the cancer report in Iowa in its entirety and further reporting on the topic, check out this story at ktiv.com. Now, cancer is an ever-changing disease requiring constant research and treatment development. But the recent cuts to government agencies by the Trump administration is impacting that work in Iowa and nationwide. According to the American Institute for Cancer Research, the National Institute of Health, which runs the National Cancer Institute, gets billions of dollars every year for cancer research. That funding helps drive long-term studies into cancer-causing agents. One of those is an agricultural health study looking at the use of pesticides and a link to cancer. The National Cancer Institute enrolled over 50,000 Iowans who used pesticides in their job in the 90s to monitor the effects that pesticides might have on the human body.
They collect very meticulous data about which pesticides they've used, what types of things they're exposed to in their water, all the different things I think that people are concerned about. And then we provide our data so that they can follow that cohort and see who gets cancer and what types of risk factors they're exposed to.
Charlton says it's critical that these studies continue to be funded because it takes decades to see meaningful results.
Important that study goes on because it's just now getting to the point where those pesticide applicators who were in their 30s and 40s back in the 1990s when they were enrolled are starting to get cancer now, because obviously cancer takes decades to develop. So they're starting to have more and more data where they could do the types of studies that I think Iowans are really interested in.
The Iowa Cancer Registry is largely funded by the National Cancer Institute. In February, the Trump administration imposed a new policy capping indirect costs for research grants for the NIH, and that cut billions in available funding for cancer research. Lawsuits filed by 22 states led a federal judge to block that policy from taking effect.